Hey everyone, thank you so much for joining us today. My name is Suzanne Garcia. I work for the Tribal Law and Policy Institute. And Asha, you want to introduce yourself?
Sure. Hello, my name is Ashay Shah. I am a senior associate at Children and Family Futures. I am a social worker by trade. I've been in the field for a little more than 8 years, and I'm really glad to be here. My focus has been for the last 7 years, really on substance use disorder, prenatal substance exposure, and their involvement with courts. So excited to talk to you all today.
All right. Thank you so much, Asha. Next slide. Oh, look, that's us. So as you can see, our contact information is there on the bottom. So if you have any follow-up comments or questions about this, we'd love to talk with you about this tool that was developed. And so, yes, and Marlon dropped them in the chat box for us all. Next slide, please. So this tool that we're going to talk about today was created in a partnership. So like I said, I work for the Tribal Law and Policy Institute. Ashay works for the Center for Children and Family Futures, and we came together under a grant that, Ashay, you want to tell them a little bit about the grant?
Sure. Yeah, so this was funded under the Quality Improvement Center for Collaborative Community Court Teams. The focus of that grant was we funded 15 sites across the country to improve services and support systems for mothers and families experiencing prenatal substance exposure. So this tool was part of that process and redeveloped under the QIC, which was funded by the Children's Bureau.
And it was an interesting grant because it had to do with substance. It put the courts in the driver's seat, right? So the entities that were eligible for this grant were all courts or court related. So it really focused on the court's role in addressing prenatal substance use disorder. Next slide, please. Okay, so we were wondering if you can, we're just kind of curious to know who's in the room. There's about 75 of us here today, it looks like. So if you could throw in the chat what roles you play in your healing to wellness courts. So we got coordinators, clinicians, health providers, juvenile probation, case managers, and coordinators. Okay, great. It sounds like we've got a nice mix of people from different disciplines, which is great. We're hoping this is going to, as much as possible, we can make this a conversation today. So if you have comments, like Marlon said, please put them in the chat. If you have questions, chat or the Q&A function, we're all going to be looking at that, and we will try to answer them as much as possible as we go. And then afterwards, when we get done, we're going to have a Q&A session. And then after that, I think Ashay and I are going to hang out for a little bit if people also want to talk to us a little bit after the presentation is done. So next slide, please. Okay, so today we are going to talk about the original collaborative values inventory, which CFF developed, its background, how it was used, and its purpose behind it. And then we're going to talk about the Indian Country Collaborative Values Inventory, the story of how it came together and how it's different from the original CBI. And then we're going to use the polls function to let you guys take some of the questions, answer some of the questions, so you get an idea of what the process is like. And then we're going to have a discussion about how the data from this tool can be used, how it can be presented to your teams, and how to request technical assistance to implement this tool. And throughout all of this, and at the end, we're really hoping to have a nice conversation about this. Next slide. Okay, so why take inventory of values and beliefs? You guys all know this. You're healing to wellness courts. By your very nature, you don't work in silos, right? You bring all of these disciplines together in order to better serve families. And fostering a positive climate between all of those various disciplines is foundational in forming your partnerships and, making them as solid and as effective as possible. Ashe, did you want to add to that?
Well, just specifically about substance use disorder and child welfare, it can be really a value-laden subject with lots of differing opinions about what's best, just based on everything from personal experience to background to training. So the inventory just it's a more systematic way of uncovering what those differences are, and being able to do something about it, versus what we see a lot of teams do is kind of not think about values and not think about how values in turn impact policy and practice.
That's right. Yeah. Next slide, please. So the purpose, why we're all here today, is to improve the service to Native families and children. If we understand where the partners share values and beliefs, we can build on those. If we understand where the partners might diverge in their values and beliefs, as Ashe and I are both technical assistance providers, our goal would be to empower you to decide how you want to proceed when your values and your beliefs don't align. Next slide, please. Okay, I think these next few slides are yours.
Sure. So just really quickly, I can go over, I think the history of the instrument is important, so I can just tell you about how it was generated and how it's been used over the since 2003. So I will read through this slide a little bit too, and the slides following, just so we're inclusive of those who need me to read it out loud. So the tool was developed in 2003 by the National Center on Substance Abuse and Child Welfare, which is housed within Children and Family Futures, which is where I work. We've had this contract for the last, I believe, 15 years. So this was an early part of that work. It was originally developed as a training and technical assistance tool to help determine the extent to which collaborations share organizational values and beliefs. So especially early on, and not until recently, the tool wasn't tested in the context of necessarily doing research. So by that, I mean, it wasn't tested in a way that you can do a baseline tool and then a follow-up tool and measure that change. We just didn't really use it like that. It was mainly used in the context of doing facilitated conversations with sites. And those sites being everything from courts to treatment to child welfare. We've been using this tool with programs and systems since 2003. So the tool contains 36 value-related items, and it's split up between 18 common misperceptions. So for example, parents who truly love their children could just stop using addictive drugs. And then you would rate that across a Likert scale. And then there are 18 currently supported beliefs. So for example, the stigma associated with addiction prevents parents from seeking treatment. All of this is administered via a SurveyMonkey link, so any kind of online survey platform. We get the results, tally the results, and feed it back to our to programs and systems. And following administration and analysis, it's really just a conversation with teams. It's a way for us to engage the entire team in a discussion, an open discussion about values without singling out. And this goes to the last point, which is gives participants anonymity. We're able to do it without singling out individual people. Just because these conversations about values are incredibly sensitive and often really difficult to have in a group of professionals. Next slide, please. So this is kind of our, I guess you can call it logic of how we think this tool works. It's about first assessing and understanding those differences in values, trying our best to mitigate what those differences are, and then coming up with the common principles and goals. I'd like to just start with kind of trying to define what values really looks like and how it plays out in professional settings. So as defined in the tool, values are really ways of viewing the world. And those values are expressed or kind of externalized via beliefs. And those beliefs are what guide actions. And in the context of child welfare or social work practice, those actions are practices, those actions are policies. So those are the beliefs are the opportunities to make changes versus those kind of really ingrained values that people often retain. One example, this is just a really kind of common example of differences in beliefs, and especially related to substance use disorder. This idea, this value of personal responsibility and how it plays into how they see substance use disorders. So individuals and professionals often see substance use disorders as a choice, right? Versus it being a medical condition. And by that, I mean, someone makes the choice to use substances and does not have, and at any time has the ability to stop. So the way that plays out in practice and policy is that they believe that supports are not needed for the individual because they can stop at any time. So that's a really kind of generic and obvious example, but those are the kind of things that we like to uncover with the tool. Next slide. So the tool has been actually recently in the last couple years, it's been validated for validity and reliability. And this kind of gets technical, but essentially with validity, we're trying to see if the constructs in the tool are actually being measured. And there are a couple different methods we used for that. One was face validity and the other was construct validity. And we did factor analysis on the tool. And then secondly, reliability is just making sure that we're achieving the same results each time we use the tool. We have the publication, which was released, I think, actually a couple of years ago. So if you're more interested in kind of these technical aspects of the tool development, reach out to us or reach out to me, and I can send you the publication and we can talk a little bit more about the technical aspects of validating this tool. Next, please. I think I'm passing it back to you, Suzanne. You're on mute.
Sorry about that. So CFF had this tool, and one of the questions, because some of the sites as part of the Quick project were tribal courts were the leads in those sites. And so they wanted to know if this tool was, I think they had an instinct that it wouldn't be applicable, easily used with tribally driven sites. So they asked TLPI to take a look at it and let us know what we thought and maybe adapt it. I'm an attorney by training. I've done child welfare for a long time, but I am by no means a research specialist. And when getting into these values, I really felt that I wasn't the right person to lead this, but I knew who to ask. So my first step was talking to Jeremy Braithwaite, who is our TLPI's tribal research specialist. And he was working on a project, the Center for Native Family and Child Resilience, that had an Indigenous Ways of Knowing work group. And so what he did is he pulled some consultants from that work group. He pulled Priscilla Day, Amira DeBruin, and Athleen Ironcloud Two Dogs, who's now working for TLPI. And we brought them together as a group to kind of lead what this would look like. Next slide, please. So this slide represents some of their observations after looking at the tool and really having a lot of thoughtful conversations about it. One of the first things they noted was that the most significant barrier to true collaboration in Indian country is very likely very different from the barriers that exist with non-native partnerships and communities. They also wanted to ensure that this was a strengths-based approach because they felt it could foster understanding about barriers among partners in these tribally driven collaboratives and could lead to more effective conversations about removing those barriers. And they were really committed to decolonizing the approach to defining and measuring collaboration and values. And it meant more than a rewriting of the individual survey terms. Let's see, we have a question. So they didn't just want to rewrite the individual survey term items. At first, the idea was that we were going to just kind of adapt it. And after having some thoughtful conversations and developing a relationship with CFF and the Quick team, they were given the go-ahead to pretty much redo the whole thing. So we have a question that says, will you be providing us access to the 36 item tool today? No, we'll get to that. We'll get to that. We're going to give you the chance to experience to take some of the questions. And we're going to talk about how you can request TA to use the tool. And we're also going to explain why we do it that way. Okay, next slide, please. After reviewing it, Priscilla and Lamira and Athleen had these kind of reflections on it. They recognized that the tool, the CVI tool, didn't capture the complexity of tribal and non-tribal partners that likely make up collaboratives addressing parental substance use disorders and the impact on families and communities in Indian country. But they wanted to have something that would move the partnerships forward in a really thoughtful and productive way. So to accomplish that, what they recommended was infusing value statements with traditional and cultural healing, teaching, and support methods towards further understanding. Next slide, please. There are questions in the tool that tries to assess the level of collaboration between the partners. And they really had some thoughtful conversations about how you measure the connectedness between tribal and non-tribal agencies. And where they landed was how they could assist agencies outside the tribal community to become knowledgeable of and comfortable with referring cases to traditional and cultural sources of support, and how they could assist agencies outside the tribal community to become knowledgeable about the culture and the history of the tribal partners community, right? So how do you learn more about the community you're serving? And that it's kind of seems like a no-brainer, but it's from our experience working with non-native partners who are working with in tribal communities with tribal entities. At the beginning of some of these collaborations, and even in the middle of some of these collaborations, they're really hesitant because they're afraid of, they don't know what they don't know. And so they don't feel comfortable picking up the phone and maybe making the referral. They don't know who to call or even where to start. So the idea was to put some questions into this tool to kind of gauge where the non-natives on the team and the non-native entities, where they were at in understanding where to get that information, and just being really comfortable in picking up the phone or seeing someone at a meeting and asking them the questions. Next slide, please. This is what I just talked about. So so this slide is really, it's what I just said. It's how to assist those agencies outside the tribal community to become comfortable and knowledgeable about referring cases. Okay, next slide, please.
Just one thing to add.
Yes, please.
That aspect of anonymity, I think, is so important, and we found it in our work as well, that people are often just not willing to have these, or rather don't have the opportunities to have discussions about values. In professional work, there's not that many opportunities to have that. So the tool being anonymous, provides that bridge for people to express themselves, but not necessarily feel ashamed of expressing their values.
It's a very good point. Okay, so now we're going to give you the opportunity to take some of these questions so you get a little bit more of the experience of what it's like when this is administered in your community. And so I'm going to tell you, because these are value-laden statements, so if we ask just all of the easy questions, we wouldn't get at what we're trying to get at. So some of these questions might, they might provoke a reaction in you. And it kind of had to be done that way to get at these difficult areas and to get at these difficult questions. We had to ask them. Ashay, did you want to chime in on that, or did I get it right?
I think that's right. Exactly. That's it. Yeah.
Okay. So I think we're going to launch a Zoom poll here, and we're going to give you, so there's going to be 2 polls. The first is 8 questions, and the second, because we were limited with the amount of characters we could put in the Zoom poll, is in a second question. So I think we're going to give like 10 minutes for the first 8 questions, and so 15 minutes overall to take them.
Yeah. So this is a subset of questions. It's only 8 questions. It's a subset of the actual tool. So we'll be able to hopefully have a short discussion about responses as soon as everybody is done.
Yeah.
So I will launch the poll, and we will be back in 10 minutes or so. I see 0 people have voted, so either I'm doing something wrong or people are not voting. Still 0.
Still 0.
We have 76 people
Oh,
on.
we can't submit till we answer them all. Okay.
Oh, okay. That makes sense. Sorry about that. Take your time.
Still reading. Okay, thank you. In fact, I'm going to turn off my video for 10 minutes to give people some time.
Okay, sounds good. I can do the same. thank you for completing the poll. I think we'll just wait maybe one more minute, see if we can get any stragglers in here. And if you're just joining us, we're doing a poll, longer poll, so please stick around, and we'll be talking in just a second.
I think we should move to the next question.
I'll end polling, so then I think everybody can view it, and then we can move to the next section.
All right.
End it. Thank you, everybody. I'm going to end polling. So I could share. Should we share results right now, Suzanne?
Sure. Yeah. Because I don't know if we can get those results back after we launch the next question.
I'm not really sure, so we'll go. We'll be safe. So let's share right now. Pretty interesting results.
So like you can see, some of these questions are loaded questions.
If you want to, for those who might be visually impaired, do we want to just read through?
Sure. Yeah. Okay. So on question number 1, is parents' love for their children is enough to overcome patterns of substance abuse? 19% strongly disagreed. 38% disagreed. 16% were neutral or unsure. 21% agreed, and 6% strongly agreed.
You can do the next.
Question number 2 is medication-assisted treatment. Prescription drugs that treat opioid addiction should be made available to pregnant women. 14% strongly disagreed, 21% disagreed. 30% were neutral or unsure. That was the majority. 24% agreed, and 11% strongly agreed. Question number 3 is fathers should have the same access to healing and support for issues of substance abuse as mothers do. 5% strongly disagreed. No one disagreed. 2% were neutral or unsure. 38% agreed. And 56% strongly agreed. And Ashe had a good point there. He's asking if anyone has any reactions to either the questions or the results that we're seeing here.
Sure.
So you can drop those in the chat or in the Q&A. Question 4 was, a parent's relapse should result in the child's immediate removal from that parent. 21% strongly disagreed, 30% disagreed. 30% were neutral or unsure, and 19% agreed. I'll get to the bottom of the questions, Ashe, before we answer the questions that are in the
chat.
Yeah, in the chat.
Sure. Yep.
Question 5, children who are abused or neglected are better off in foster home or foster care or adoption. 6% strongly disagreed, 43% disagreed, 22% were neutral or unsure, 29% agreed. No one strongly agreed. Question number 6, substance abuse treatment programs and policies may reflect inherent biases that impact Native patients' likelihood of success. 2% strongly disagreed, 6% disagreed, 37% were neutral or unsure, same, 37% agreed, and 19% strongly agreed. So the majority of people there were either agreed with that statement or they were neutral or unsure. Question 7, non-Indian families can raise Native children just as well as Native families can. 19% strongly disagreed, 33% disagreed, 27% were neutral or unsure, 19% agreed, and 2% strongly agreed. Finally, question number 8. Parents should not be allowed visitation with children removed after their care or removed from their care until they demonstrate abstinence from alcohol or drugs. 17% strongly disagreed, 35% disagreed. That was the majority. 19% were neutral or unsure, 16% agreed, and 13% strongly agreed.
Interesting.
Let's see.
Yeah, there are a couple questions.
Mm-hmm.
So
Carol asked if the values instrument measures differences among the socioeconomic participants completing the survey. Very good question.
So we haven't done that in the past. No, there are a couple different demographics that we do collect. Obviously, location, but what type of professional, what kind of system you come from, and then another one would be what level of professional are you? Are you frontline staff? Are you executive leadership? Are you administrative? But we have not collected socioeconomic status of those completing the survey. Be interesting though. The next one was a question about, is this relapse? And I think we're referring to like a drug or alcohol relapse there in that question. Suzanne, did we lose you? Are you still there? You look frozen. Looks like we may have lost Suzanne for a second. Let's see. We can go through these questions. On question 4, I did neutral, not sure, since it would depend upon the facts, circumstances, as to can the home be made safe and the children remain at home. Yeah, I had the same response to that question. That's a really good point. And maybe even the question could be clarified to make that to make the question more clear. But yeah, I had the same reaction to that question. It's a good point, Carol. And then these questions are open-ended, and each instance is on a case-by-case basis, such as children being removed until abstinence from alcohol or drugs. This can be strongly agreed upon if this is a repeated occurrence at all scheduled visits. That's a good point. I think I think you're trying to say that it's similar to what Carol was saying above. But yeah, that's a really good point.
Sorry about that, everybody. I now have storms and my internet went out. Say, yay, iPhone hotspot.
Good to have you back. So we just went through some of these questions, which were really good questions, and I think actually inform some of the development of the tool too, as we begin to think about it and possibly refine the questions.
Okay, great.
So I mean, these are really interesting results. I mean, the first thing we would do as kind of TA providers and looking at these results would be to look at what values or what responses are divergent versus there's great agreement on them. So for example, one that really stood out to me was the one about fathers, which is question number 3. Fathers should have the same access to healing and support for issues of substance use as mothers do. There's pretty strong agreement, either agree or strongly agree that fathers should have access to the same supports as mothers do. So it's an area really to build on with the team. So in addition to looking for those opportunities for change, we're looking to build on those strengths within a collaborative team. Any other that stood out to you, Suzanne? Have you had a chance to look at these?
No, I was actually busy logging back on, so.
No problem.
But I am curious about do we want to do the second poll or?
Sure. Let's do it. Stop sharing results. And then, all right, I'll launch this poll. We'll give people just a minute or so to do this one. Thank you. All right, looking pretty good. Almost 50%. And again, this question is kind of geared for if we were actually doing this in a collaborative group, but.
Let's see, it's Terry's question.
Okay.
Yeah, I can't see the percentages this time.
Oh, sorry.
That's okay.
So we're at about
this time. I don't know if it's because I logged in differently and we got thunderstorms going on outside.
Not sure. So I think we're pretty good. We're above 55%. We're at 55% right now. So I can end polling and just share the results. Thank you, everybody.
We do have a question in the chat.
Okay.
Want to address that now or after you share the results?
I'll share it and then we can.
Yeah.
Okay.
Okay, so this question was, When I think about the quality of connection among partners relative to knowing and understanding the culture and history of the people being served, the collaborative has, and there's multiple choice. So 18% said an absence of foundational knowledge of the history, culture, and dynamics of the tribe being served. 34% said a general awareness of history, culture, and dynamics dynamics of the tribe being served, but not of cultural, traditional sources of healing and support. 59% said an awareness of the history, culture, and dynamics of the tribe being served, as well as knowledge of where and how to locate information on important tribal practices pertaining to child welfare and or key services provided to children and families. That's the majority. And then 32% said awareness of history, culture, and dynamics of the tribe being served, and many members are active participants in the culture events. Awesome. And 23% said many members who have strong relationships with tribal and community leaders. Those are good percentages. Those are good. And these are going to be different depending on the nature of your collaboration, whether it's all intra-tribal or if you have a lot of non-native providers who are part of your team, I think.
Yeah. But it can be pretty instructive in just gauging where a partnership is.
Mm-hmm.
Yeah.
Agreed.
Did you want to address this question from Terry? I think, or not?
Well, I want to acknowledge it. So the question in the chat is, what would happen if you studied people who had been taken from their homes due to substance abuse who are now adults? Is there lasting negative effects from being kept from their parents for even short relapses? Are the ones who were given no access to their parents better off than those who were given some access? So that's, I think, the $1 million question. I don't know of any studies on that. Ashe, do you know of any? Or Precious?
Yeah. There's been a lot of research. I'm just trying to read the question a little bit more. Is there lasting negative effects being kept from? Yeah, I mean, there's a lot of research on separation. And even in terms of separation of kids at the border, there's been a lot of research on just even temporary separation and its effects on kids, even for a short time. Just that loss of bonding that occurs in those short times, but yeah, again, it's individual circumstances though, right? I mean, the research could say one thing, but each case is different. In incredibly abusive homes or neglectful homes, obviously, sometimes children just can't remain. But from a research standpoint, the data does show that even short separations can have longer term impacts on kids.
Thanks, Ashe.
I will stop sharing. All right.
All right. So thank you. We wanted to give you a feel of what the questions were for the tool. So now we're going to, on the next few slides, we're going to talk about the structure of the tool and some of the considerations that went into how it was put together. So next slide, please. So the very beginning of the tool really it invites the participants to reflect on the effects of parental substance use that they see. Grandparents raising children, substance use as a coping mechanism, parents who are spiritually out of balance. And because in this tool, we're really trying to walk a fine line between being strengths-based and including questions that would welcome respondents to answer honestly, right? Because you can be trauma-informed and resiliency focused, and you can recognize the effects of historic and intergenerational trauma, but that doesn't completely negate the strong emotional reaction that people can have when working with families who struggle with substance use disorders. They can recognize all of that, and they can still have this deep-seated feeling that parents are being selfish, and there are people who still believe that committing to successful recovery is a choice, like Ashay was talking about before, and that anybody can make it if they want to bad enough. So that's, at the very beginning, it asks people to kind of reflect on these things. And then it goes into demographics, like we kind of talked about before. So it gets your role within the agency, like Ashay was talking about. Are you a director? Are you frontline staff? What discipline you are? Importantly, how long you've worked there. Also importantly, Priscilla and Lamira and Ethelene wanted to know whether the participant lives in the community served by the organization. When it came to the quality of the connection, how the collaboration, how all of the partners are working together. What they wanted to know was whether the partners understood the culture and the history of those being served. I think in the original CVI, the quality of the partnership was gauged differently, right? So Ashay, can you talk a little bit about that?
Yeah. Can you say that one more time? Sorry, Suzanne.
Oh, just the quality of the connection, how that's measured in the original CVI?
Yeah. Let's see. Right. I mean, it was less. I think like most of the tools been adapted. It was less strengths based, and now I think we've made some really positive changes to be. There's no other way to say it. To be more strengths based with how we're assessing connections and collaborations and partnerships.
Yeah.
So it's really just a kind of a total paradigm change of looking at the way we're assessing how people communicate and how people partner.
Right.
Yeah.
Agreed. And we had someone raise a hand. So we were wondering if there's a question or a concern that we can address.
I think that was an accident.
Oh, okay. Yeah, I think the original CVI talked about the strength of the collaboration, whether it was gauged more on, do you have written protocols that everyone has agreed on? And do you have written vision statements that everyone has agreed on? And the team that put this together, this CVI, this version of the CVI together, they wanted to know more about what people knew about the community being served. So I think that's where it kind of diverged there. So the tool talks about demographics, it talks about collaboration, it talks in the Likert scale, which is the strongly agree to strongly disagree, on three main areas: substance use, treatment, support, and healing, and historic trauma, and resilience. So that's kind of the structure of the way the tool is laid out. But importantly, at the very end, there's a number of open-ended questions about the level of collaboration, how it can be improved, and how well tribal sovereignty is supported by the partners. And finally, it invites the participants to talk about the training needs that they might they might see for themselves or for the rest of the collaboration. So that's the way the tool is kind of structured. Next slide, please. Other questions that are in there are, parents who do not want to participate in formal treatment should be allowed to explore other options. It invites people to agree or disagree. It invites them to weigh in on whether substance use treatment professionals involved with parents should have input in decisions about child safety, custody, and living arrangements. On the flip side of that, it also asks if child welfare professionals should be able to weigh in on substance use treatment. So it was kind of digging into roles that you might see in the collaboration. It invites people to weigh in about programs, whether programs that provide methadone and other medication-assisted treatment, such as buprenorphine and Suboxone. I hope I said that right. For an opiate use disorder, are just substituting one SUD for another. It invites people to weigh in on whether relapse should result in a child's immediate removal from that parent. And finally, well, not finally, but one of the questions has to do with historic trauma. It invites people to talk about whether historic trauma is a demonstrated risk factor for developing substance abuse. Next slide. Okay, now we're going to dig into how the data from the CVI can be presented and used. And you kind of saw something of that, I think, from looking at the results of the polls, but Ashay is going to show some of the, because they use SurveyMonkey, they can make these beautiful charts and graphs. So take it away, Ashay.
Sure. So I'll just show, we're actually running out of time, I'm surprised. So I can do this quickly.
We are.
And then we can give you a little instruction on how to request this, how to put this in, which is so cool. I think this is kind of a different kind of presentation. This can lead to, direct action if you would like to request this tool and have this facilitate conversation about, values. So next slide, please. So this is, I mentioned this a little bit earlier based on Carol's question about how we could use this tool to look at values across different systems. So we do collect information on what system the person completing the survey is from. So this is one example. I forget what the total number, but this was a big sample that we used for, I think it was like state level. So we had multiple counties completing this survey. And this was the breakdown of each professional who completed the survey. As you can see, the majority in this are child welfare. And then this second most would be, let's see, medical providers. So first, which is almost half, would be child welfare, and then the 11.9% were medical providers. Next slide. So this is another way to break down who's completing the survey. This is based on what level of staff or what level of profession they are. In this graph, you can see that the majority are frontline staff or direct service providers. And this plays a lot into what the results look like. They really do. So this is an important question and I'm not going to show how we break it down for each question, but it is important to look at each question by this demographic as well. So the next graph actually on the next slide shows a breakdown of one of the questions of how you would actually look at one of the questions by profession type or system or program type. So it's a little, I know there's a lot here. Just to break it down a little bit, On the bottom axis is the Likert scale. So from strongly agree to strongly disagree, and then each bar represents a system. So as you can see in this graph, child welfare are more likely or to even to be between agreeing and disagreeing, with a higher percentage of neutral or unsures on this one. Court staff are equally agreeing and disagreeing to this question. So I don't know if I read the question. So the question is related to methadone and buprenorphine. Programs that provide methadone or medication-assisted treatment are just substituting one addiction for another. So that this is the way each system responded.
And that's one of the things I really like about this tool is you can look not only at your program overall, your partnerships overall, but in the individual disciplines where they fall on answering these questions, where their values, where their beliefs are. And that can help you target training needs and also target discussions. I really like this one.
Go to the next slide, please. So a similar question and a similar way to display the data. I think what really stood out for me here was actually the differences compared to the last question, because they're very similar questions. In the previous question, there was some divergence in their acceptance of medication-assisted treatment. But when you ask the question directly, should medication-assisted treatment be made available to pregnant women? A lot of people do agree. So this would be a really interesting discussion to compare to the previous question and how this actually plays out in practice. Go to the next slide, please. We'll go through these quickly, sorry. So parents should not be allowed visitation with children removed from their care until they demonstrate abstinence from alcohol or drugs. So this is definitely a sensitive question, but what really stood out to me here was the substance use disorder treatment responses. Let's see. So 35% agreed that they should not have visitation unless they're completely abstinent from drugs or alcohol. So I think just looking at that response and looking at how that specific system responded to this question, there's opportunities for training. Next question. Unless Suzanne, jump in, please. I know I'm going fast.
No, going fast is fine. I was answering some things in the chat, so.
Okay, great.
Perfect.
Another similar question. So this is children who are abused and neglected are better off in foster care. Another similar breakdown, but another opportunity for training. You can see that maternal health strongly agreed that children who are abused and neglected are better off in foster care. So obviously they're more in line with protecting children and ensuring their safety. So it kind of makes sense that they would respond to this question this way, but it just opens the door for one, for dialogue about what this means, and two, for training. Next, please.
Next slide.
Am I passing this to you, or do you want me to do this one?
I can do this one. So basically what this tool allows it to do, because it's SurveyMonkey, is, so this slide talks about items with most consensus where everyone strongly agrees or agrees. That shows you where the most consensus is. So of course, those are things you can build on. And also maybe you might not want to target training and technical assistance there. Next slide. And on the flip side, if you've got, so this slide talks about items with the most consensus strongly disagree or disagree. These are areas, if you've got, if people strongly disagree on an area, again, it could be a strength you could build on, or it could be something where you really need to dig in and have conversations. Sound about right?
Yeah, sounds about right. Yeah.
Okay, next slide, please. And sorry, we are running out of time. We thought we were gonna, wasn't gonna take this long.
Do you want to jump to that question, the slide about actually using the tool, or?
Sure. Yeah. So yeah, basically we use this tool to drive planning and technical assistance, and to set priorities, and also that. But do you have the difficult discussions now, or are energies better spent elsewhere? This tool really allows you to dig in and have those conversations. Next slide, please. Okay, so for using this tool, we like to do it as part of an ongoing relationship, or some kind of a relationship with the program. So you would contact, you're all healing to wellness courts, so you could contact your TA provider to initiate the request, and that would set things into motion. We need at least 3 weeks in advance to set up SurveyMonkey and to have the conversations with you, because we don't want to change all of the questions, but if there's certain terms that are specific to your site, you call your Child and Family Services a certain name, we can tailor certain things like that. So, we're going to put a team together and we're going to work with you. The consultants were really strong in that, because of the sensitive nature of these questions, it's essential that a native providers be part of the team. We did a mini trial of this, and the pushback we got, we expected it, but was who are asking these questions, who put these questions together? Because these are value-laden questions just by their nature. So you need someone that people are going to trust are coming from a good place in bringing this tool to your community. But you also need facilitators who are going to be skilled in unpacking some of the emotions that are going to be I think they're going to happen, right? So people are going to have strong reactions to some of these questions. So we really want to make sure that the team that is providing this is going to help meet your needs and frankly not do more damage than good. So you put in the request, we work to develop the questions and tailor them to your needs, and then Children and Family Futures loads the survey onto SurveyMonkey. And we give you a link, and everyone can sit at their desk and take the survey anonymously. And it really gives them time to think about it. And then after the results come in, the TA team works with you to present the results and prioritize what the next steps are going to be after you look at what those results are. Ashay, did you want to add into that?
Nothing else, you covered it.
Okay, great. Next slide. Q&A.
So
Okay.
we did have a few new questions come in. Quickly, what if the tribe is no longer operating under a grant for drug court?
Thank you, Carol. I think, knowing TLPI the way I know TLPI, we would try to find a way to accommodate that. So please don't hesitate to reach out, I guess, is the overall message.
Great, thank you. And Terry also has a question. The question about foster care is exactly what I was alluding to in the previous question. Are we trading the child's long-term well-being for short-term safety if we completely remove parents from the child's life? And is there room for compromise of keeping the relationship alive through preemptive actions while still removing the child from a home where substance use is impacting the quality of parenting?
Let's see.
Big one.
Really good questions. I think, because Asha and I we'll be here after the formal presentation is done. So be happy to toss that idea around with you and discuss that with you. So I guess that I'd like to kind of end this with saying that, if you would like to talk about using this tool, bringing this tool to your collaborative, please reach out. The team that put this together was so excited to do the work. We think it's a great tool and can be used in really productive ways.
Thank you. Appreciate it.
All right. Thank you, Ashay. Thank you, Suzanne. And thank you all for attending today's Family Track workshop entitled The Indian Country Collaborative Values Inventory, Creating More Effective Collaborations to Serve Families Affected by Substance Use. Recordings will be posted on the conference platform and will remain up until July 30th. After this time, you may find recordings at enhancementtraining.org. And I have posted the link to the evaluation in the chat. So please click on this link now and take a moment to complete the evaluation. There is also a sign that links to the evaluations in the main virtual lobby. Your feedback, as always, is greatly appreciated. Yeah.